Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm Will Rucker.
And I'm Ciara Owens.
And we are so excited for today's program. Now listen, I always ask you to tell folks to tune in, but tell folks to tune in. Today we have some information you've got to hear. Your folks need to hear it. Your neighbors, your cousins, even the people you don't like, they need to hear this. So let them know A Healthier Tomorrow is on the air right here on the People's Station, Power 88.1.
Yes. So as far as it goes, well, how you doing on this Wellness Wednesday?
You know, I'm doing pretty good. I'm staying hydrated. I am resting. I am looking at the bright side of life because a lot is going on that could make you unhappy. But I am choosing to find joy each and every day to stay healthy. And we live in a great place. Vegas is the most fabulous city on the planet. And so, I mean, that keeps me healthy.
Yes. And the weather is nice outside. Let me tell you, I'm outside walking Chico multiple times a day.
Hello.
Just because it feels good. It means I'm moving, getting active, health as well.
Yes, it is. Yes, it is. And speaking of health being wealth, the Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. April is Healthy Homes Month, which increases awareness of home-related health hazards and the importance of reducing exposure to secondhand smoke in the home. For education and resources to help you live tobacco-free, visit our website at gethealthyclarkcounty.org. And if you want to just type in the full thing, it's gethealthyclarkcounty.org/live-tobacco-free.
Yes. That's the goal, ultimately. I'm excited about today's show.
Me too.
Like, me too. I always love the guests, but it seems like this is so timely. Like, it was written for me and written for my world and my family. So, Mama, I hope you're listening.
Same for mine. Same for mine. We have one of my favorite people in the galaxy in the studio with us today. She is also one of my hometown girls from Detroit, Michigan. So, shout out to the D, home of Motown. But most importantly, she is helping us to live healthy through health equity. Miss Tina, would you introduce yourself?
Thank you so much, Will. You are beyond kind, and thank you for remembering our lineage. Yes, my name is Tina Dorch. I have been here 20 years, so I guess now I'm a native. And I do manage the Office of Minority Health and Equity for the state of Nevada. We are a program that is through the Department of Health and Human Services, Will.
Awesome, awesome. So give us a little overview of NOMI.
Yes, thank you. That is what we affectionately refer to us as NOMI. We have to have a good acronym, right?
Yes, it sticks.
It sticks. It does. It kind of rolls off the tongue, NOMI. But the office has been around since 2005, everyone, in various iterations, right? I have been the manager. I've had the privilege of serving in that position since for 7 years.
Wow.
It went by fast, everybody. But what the office stands for has been very constant, and that is to be a voice for individuals in our community that may not realize the importance of health and all the preventative components of health and how to make sure that access to these resources are equitable. So the office as a through line has always worked on that. When I came into the office in 7 years ago, there was a new phrase that came into the lexicon. The late Tyrone Thompson was the sponsor of a bill, and the office went from the Office of Minority Health to the Office of Minority Health and Equity. And it made a huge difference. Equity, as we know, is very different.
Yes.
It empowers people.
Yeah.
So the office is about health literacy. It's about systemic change. And then also we added the word minority in a more different context, to be more inclusive, to represent all the intersecting communities that can be viable if they had the right resources at their disposal. And sometimes they're under-resourced. Sometimes they have not been made aware of things of that nature. So we talk to people who you don't necessarily think is minority. It's not just limited to ethnic and racial subpopulations. We talk to people who are differently abled. We talk to people who are unhoused. We talk to people who have economic deficits. We talk to people who maybe because they live in our more frontier communities have a underserved need, right?
Yeah.
So the office is talking about all these social determinants of health, how they intersect with health, and how we can make differences that are systemic and lasting.
You talked about this being 20 years. 20 years is a big deal, doing especially the powerful work. And you talk about connecting people with resources and different things of that nature. Where can they find these resources that you are asking us to dive into?
Well, thank you, Ciara, for the question. Know me, as Will knows, we are not a service providing entity. We're not out there putting the shots in arms. We have friends at the health district that we partner with to do that. But we advocate. We amplify. We are there to help make sure that you can navigate some very, very tricky resource identification and find them. So, for example, being in the director's office with the Department of Health and Human Services, as you know, DHHS, another acronym, is,
and you say it with just the flow of the tongue so easily.
But I know that people, I have to always remind myself, a different world. Everybody doesn't walk in my world. So the Department of Health and Human Services is what we refer to as the safety net department, right? Aging and Disability Services, the Department of Public and Behavioral Health, so many of DWIS, Department of Welfare and Supportive Services, and for right now, at least Medicaid is beneath our umbrella. Mm-hmm. So it's difficult to know what all the resources are among those major behemoth individual divisions. We help you navigate that. We put them out there in the community. We raise awareness. We do education. So we promote you. We promote the heck out of you if you allow us.
That is fantastic. And I appreciate all the different lenses you put on this, because when we talk about minority, sometimes people feel that that's a demeaning term. And the way that you have presented it, it's like, no, we need to call these different things out. So we are heading into Minority Health Month. Mm-hmm. Why is it important, especially now?
Well, and just to piggyback on that, when I use the word minority, sometimes I catch myself and I say minoritized communities, right? Because sometimes you are made to be the minority.
Yes.
Right? It's not a birthright. You have been minoritized. So anywho's, your other question about
Minority Health Month.
Yay, we love, this is our Super Bowl Sunday times 29 days. or 30 days, just 31 days. So we use this month to the full advantage. We have, it's a nationally recognized moniker, and we just amplify based on that recognition that there are activities going on around the country that talk about what we're talking about today, and we use it to our fullest benefit.
So we've talked about this. We highlighted it during our last show 2 weeks ago, but you are here really talking about an event that I need to make sure that my mom gets to, I get to. Tell us about National Healthcare Decision Day, planning for your future.
Yes. Thank you for asking, Ciara. You have such good questions.
Hype me up.
So this is another national day, Healthcare Decision Day. It is April 16th. It is a day that, sometimes is undervalued, underappreciated, because it talks about how to make sure your wishes and preferences are known to not only your family, but your caregivers.
Wow.
And it sounds like something that you maybe can put off and I'll deal with it later, but you really can't. Right. Because sometimes you have a chronic illness and you deal with that every day. You can't forget. But sometimes you're in an auto accident, and that auto accident renders you unable to communicate or to advocate. And unless you have documentation on standby and you've identified who your caregiver is, what your preferences are for healthcare, and they could range from perhaps wanting to only be given IV fluids to being intubated. You have to let that be known.
Yeah, like a DNR.
Or like a do not resuscitate. Exactly. And again, it is not something warm and fuzzy to talk about, but having these conversations and making your wishes known in advance, in my humble opinion, is a sign of love for your family.
100%.
Yes, clear is kind. It leaves no interpretation, which I definitely welcome.
Ciara, say that again.
Clear is kind. We say that a lot here, and I think it's just across every sector, it's important for people to know.
Absolutely. So it's a free event to empower our community.
Yes.
Why should people show up? Who's going to be there?
Yes, free. It is free. It is free. And actually, one of our wonderful partners in this event is helping us with promotions. We've got the Latin Media Network. They're going to be there with 2 radio stations giving away free swag. So come and get some free swag while you're waiting to talk to the Legal Aid Center of Southern Nevada. They're going to be providing general education on legal documentation. Then you're going to also have some very very specific subpopulation focused legal advice there. That's going to come through the Southern Nevada Senior Law Program, and the name tells you who they're going to be advocating for. Also, the Nevada Disability Advocacy and Law Center.
Okay.
So the name, once again, we are very, very protective of our differently able population. And then another partner that is underknown and undersourced, I think, is the Secretary of State.
Yes.
We love them. We work with them often. They have so many amazing products, but on the 16th, they're going to be there talking about the lockbox. And
what is the lockbox?
It is a cloud-based resource where once you have your documents in order, you can repository them there. They stay there. They hang in the cloud. It is secure. It is safe. And then our healthcare providing systems, they know to check this lockbox. So if you're there again in a horrible scenario where you're unable to vocalize or you're unconscious or some other debilitating circumstance, they can understand if you have a do not resuscitate order, who your next of kin is. So you're left with someone to advocate if you can't do it on your own. So that lockbox is free. And it's through the Secretary of State, and they're going to be there talking about it.
Wow, that's so important because that means your spouse don't have to fight with your kids or your parents.
We don't like that. We don't like that at all. That is in that moment in particular, be it a chronic disease or a flare or an episode that takes you to the hospital, or heaven forbid, your life has come to an end and you're now trying to make plans.
Yeah.
The last thing we want are families that are going to be at odds with one another when they should be coming together. Yes. This should not be a problem. I had a personal experience with this. I think I am no different than others, but I lost a parent during the COVID, and I just wish that we had this kind of documentation on hand. And there's ways to just collect this information. As I said, the lockbox is just one, but just having these documents in order. I just want to say, and I left out a partner, and I don't want to leave out partners because they mean the world to us. We have a late ad, the Asian Community Development Council.
Oh, we love them.
Yes.
That's why I was like,
I know I had to shout them out. I would be so remiss if I didn't, but they are a late ad, but they are very much welcome. They're going to be talking about their resources. And then lastly, we're going to have a community health worker made available through the Southern Nevada Health District. And so while you are waiting to be seen, you can have these other secondary conversations. You can hang out with the radio personalities. But we are asking that people register. If you find Nomi's easy to find. We have a horrible website address, but if you Google Nomi, the Nevada Office of Minority Health and Equity, we always come up.
She's so honest.
She is. I'm trying to change it, y'all. But it's, there's bureaucracy at play here. But if you Google Nomi, the Nevada Office of Minority Health and Equity, we come up. If you have our flyers, I think you've been so kind as to post them, and we're sharing them everywhere. There's a QR code. There are links. But we do ask that you register so we can have enough professional attorneys on hand.
Yes.
We can kind of plan for it. But we absolutely will take you also if you walk in off the street. We want you to know that. So while you're waiting to be seen, you can get your vitals checked through a community health worker. You can hang out with the radio personalities.
I'm going to be there.
I hope you'll be there.
Oh, okay. Hey, no. Radio personality.
So it is the 16th from 10 to 1.
And where we at? Where are we going to be able to meet as community members, family caregivers, and community advocates?
Thank you. It is at United Way of Southern Nevada, wonderful advocate and partner to the community.
Yes, indeed.
And they are located at 5830 West Flamingo Road.
All right, y'all. She didn't highlight this, but there's going to be languages available for additional support. ASL, Spanish, Tagalog interpretation will be provided by the amazing hosts at the United Way. And as she said, registration is highly encouraged, but not required. If you have any questions, go ahead and send an email to NAMI at dhhs.nv.gov, or you can give them a call at 702-486-2151.
The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Our team has recently launched the updated English and Spanish smoke-free housing directory. The directory has over 60,000 smoke-free living spaces listed, ranging from senior housing to luxury living. To view this directory, please visit our website at gethealthyclarkcounty.org. now, with that in mind, Tina, you going to stick around for us?
Yeah, so I can.
Awesome. We have another fantastic guest. She is no stranger to the show. Nelly, welcome back to A Healthy Tomorrow.
Thank you so much. It's wonderful to be here.
So tell us about what's going on. What is the Nevada State Apartment Association?
Well, that's one of our partners in the smoke-free housing unit initiative, and the Nevada State Apartment Association, along with many other community members such as the Southern Nevada Regional Housing Authority, Nevada Hand, and many other partners, are solid partners of ours that have been working on the smoke-free initiative for several years now. They've been a wonderful aid to us in just allowing us to kind of have access to, residents, to community managers, and help us push out this message.
I love that every single person on the show today is talking about coalition and not doing any of this work in silo and in partnerships and really working with others. Nelly, what does it really mean for us to have that multi-unit housing landscape? And what does it look like here in Nevada overall?
Yes. So the multi-unit housing landscape in Nevada, we know that as of 2024, at least 60% of housing units in Clark County are contained in multi-unit housing structures. That just means there's a substantial amount of people in Clark County living in multi-unit housing. It's a big market. So we definitely try to work with multi-unit housing communities because we know it's where people really get exposed to secondhand smoke. It's a big market, and that's where the exposure is happening of secondhand smoke.
And let's dive into that, which is a conversation we've had before. This is actually the first show we've ever done that I did with Healthier Tomorrow. What is the issue with secondhand smoke?
Yeah, so the issue of secondhand smoke is we know that at least 60% of air in an apartment can come from other units, making secondhand smoke unavoidable unless the building is completely smoke-free. We know that secondhand smoke can infiltrate in multi-unit housing neighboring units through walls, vents, hallways, shared ventilation systems, outlet fixtures, balconies, even patio areas. There's no safe level of exposure. Okay, let me repeat that. There is no safe level of exposure.
There's no level.
No level. No.
None at all.
Any small amount is harmful, basically. And we know that it is also responsible for more than 42,000 deaths annually in the U.S. There's a lot of myths of, like, what if we put great ventilation systems and all of this? That is all, it's a myth. It's not real. There's no amount of ventilation that you can install in a unit to make it safe for a living environment if there's exposure.
Yeah, thank you for sharing that. I think that's so important for our community to hear. And Nelly, you also didn't come alone today, so you brought a guest with you. Would you introduce Robin to us?
Of course. A wonderful guest, a great partner of us, Robin. She's here with the Nevada State Apartment Association. Thank you for being here today. I know it was a big challenge, and thank you for making it happen.
Absolutely. Thank you for having me. I'm excited to be here.
Absolutely. So tell us a little bit about your work.
So the Nevada State Apartment Association is a trade association. We're a membership guided association. So our mission pertains to the rental housing providers throughout the state of Nevada. We elevate them by providing political advocacy, education, networking, and community outreach opportunities.
Power in the coalition. So as Nelly was talking, and Robin as well, there's no safe way to do this. And so what does the Southern Nevada Health District suggest for us to do to combat secondhand smoke?
So the only way to fully protect communities from the dangers of secondhand smoke is to eliminate the smoking completely, correct? And that means we have to establish voluntary smoke-free policies in multi-unit housing. So the health district developed the initiative Be Healthy, Breathe Easy, Live Smoke-Free. And this was to help reduce secondhand smoke exposure, again, in multi-unit housing, and increase the number of smoke-free living spaces available for residents in Clark County.
I love that. But Nelly, I need you to say that name for me one more time.
Be healthy, breathe easy, live smoke free.
I love that. We're going to clip that and just air it over and over again.
Yes.
Yes.
So, Robin, how does NVSAA and the Southern Nevada Health District collaborate in order to create healthy environments in these multi-unit housing communities that we know are all around Nevada?
Absolutely. We've developed a year-over-year collaboration where we partner on educating our members, again, who are the rental housing providers throughout the state of Nevada. But specifically, obviously, we work here in Southern Nevada together. And we provide outreach in the form of sending out email campaigns to our members. Nelly will attend events of ours and talk face-to-face with our members, and just providing that education and support and resources for them to be able to provide those smoke-free environments in their housing communities.
All right, so let's have a tough conversation. I have a neighbor, or I'm the neighbor, right? Depending, situations, that are exposing the rest of the community to secondhand smoke. What can we do to kind of work towards that amazing tagline that Miss Nelly shared with us?
I think ongoing education is always going to be key. Letting the property managers and the owners understand the health risks, and that there hopefully are resources that they can reach out to in order to make that happen, to build a better living environment for all of their residents.
And I'll add to that. That's definitely what Robin said. And also, if that doesn't work, sometimes we know there's challenges when you want to try to speak to managers, because there's a lot of other priorities that can happen and be going on with the multi-unit housing industry. And so if that doesn't work, or you're having issues and still nothing is happening, you can reach out to us. Southern Nevada Health District, our office, can try to assist by just simply facilitating communication. We can reach out to the manager, speak to them on your behalf, and encourage policy adoption if they don't already have one. We can help them. All of our resources are 100% free. If they already have a policy in place, we simply help them enforce it by providing free signage, promotional items, anything that they need to really highlight that policy, because sometimes it's just a matter of letting your residents know, hey, this is a smoke-free community, and they don't know, so we provide all of that technical assistance to the property managers, and we can definitely assist or try to assist the residents in that way.
And how do they get in touch with you for that assistance?
Of course. Our office number is 702-759-1216. And that's the way you can contact our office directly, and we can assist.
Awesome. Well, Robin, Nelly, thank you so much for sharing this information with our audience. This is important. We've talked a lot about the what. Before we go off air, because we're running out of time, I do want to know the why. So, Robin, why is this important?
It's important that every resident has a place that's safe and healthy to call home.
Nelly?
I have to agree. Everyone living in multi-unit housing deserves the right to breathe healthy, clean air.
Beautiful. Well, for more information, again, you can visit gethealthyclarkcounty.org. Pretty easy to remember. This matters to our community. We deserve it. We deserve it. So thank you for the work that you're doing.
Thank you.
Thank you so much.
All right, Ciara, we've got some announcements, but I want to kick off with just a reminder. If you happen to tune in a little late, maybe missed the first discussion, I want to just reiterate this event that's coming up. Then we'll go to some other community events. So, Tina, tell us about what's coming up the day after Tax Day, April 16th. You've got a big event.
Absolutely. Thank you for the reminder and allowing me to reiterate that April 16th from 10 a.m. to 1 p.m., the Office of Minority Health and Equity is going to be hosting an event that recognizes National Healthcare Decision Day. We will be at the United Way of Southern Nevada, 5830 West Flamingo Road.
Awesome. National Healthcare Decision Day, April 16th, 10 a.m. to 1 p.m. at United Way of Southern Nevada, right there on Flamingo Road. Ciara, what else is going on?
All right, y'all. So April is also Autism Awareness Month, and there's going to be an amazing panel moderated by Lady AK that's going to be called Speak Up for Autism, a North Las Vegas Town Hall and Resource Fair. It is going to be at Nevada Partners on Saturday, April 12th from 1 to 4 p.m. Nevada Partners, which is 690 West Lake Mead Boulevard. You're going to have some amazing speakers. You have Shanae Glass, an autism mom and an IEP advocate. You have the Assembly member, Miss Cynthia Zareno Moore. You have Stephen Cohan. You have Miss Kashia Boone. You have Latoya Horton. You have so many people that are going to be diving in. Please join them this Saturday. You also will have the opportunity to engage in Las Vegas Community Day of Joy, hosted by Miss J. Marshall. It's going to be a day filled with laughter. She says no titles, no logos, no ass, no negotiations. negotiations, no politics, just fun, sun, laughter, and creating memories. That is going to be Sunday, April 27th, 2025. And then we also have the AFAN's AIDS Walk, Las Vegas, which is going to be Sunday, April 27th. The festival starts at 9 a.m. The walk starts at 10 a.m. And you can register at afanlv.org. Do we got time for one more?
We got time for one more.
All right. So last but not least, we're going to sit there and make sure we highlight the African Americans Men's Health Summit Prevention and Wellness. That is going to be Saturday, April 26th from 9 a.m. to 2 p.m. It is free and open to the public with light refreshments. It's going to be at Doolittle Active Adult Center at 1930 North J Street. Space is limited, so if you have any questions, you need more information, please do not hesitate to call 702-675-0209.
Can I get in on this one?
Oh, get in.
I've got an announcement. I'm so happy. The Community Health Assessment Prioritization Meeting is happening on Wednesday, April 30th, 2025, from 9 a.m. to 12:30 p.m. right there at the Health District in the Red Rock Conference Room. That's 280 South Decatur Boulevard, over by the Red Lobster, if you don't know where that is. So you can register in advance. We would love for you to register, but you can also just show up in person, or it'll be on virtual. So tinyurl.com/2025 CHA priority. You can register there. Let your voice be heard. This meeting will share the priorities of our health for the next 3 to 5 years. So that's important.
Yes, long-term planning. For sure. And before we go, y'all, if you need some help navigating Medicaid or anything as you sit there and plan to take care of your health, please do not hesitate to email Katie at katiemartinez@thecenterlv.org or call 702-906-1859.
Ciara, we got about 30 seconds. What do you want to leave with the people?
Hey, y'all, have a great Wednesday. Go outside, get some of this fresh air, and enjoy this weather because it's going to start getting hot.
This has been A Healthier Tomorrow. I'm Will Rucker.
I'm Ciara Owens.
And as we always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live compassionately and live healthy. We'll see you next time.
Bye, y'all.